All right, thank you so much. To finalize my question and bring this topic to an end, I would like you to generally tell us how we can take care of our mental health, like, going for checkup and all of that. I know, being a very learned person, you would have been doing that. There are some women that will tell, you ask, when last did you go for checkup, they'll tell you which one is the checkup. I'm not sick and all of that. So how do we, is it something we can do that is like a routine check yearly and all of that? Have you done that? How do you think women generally can be doing that?
Okay, so I think mental health, a lot of people do not even know what it is. They feel as long as they are okay in their bodies, then their mind will fall in line. I remember during COVID-19, we were all locked up at home, children were doing homeschooling. I was overwhelmed. It wasn't a lot of work, but it was an entirely different feeling. Like the children were home 24/7. I felt overwhelmed, and I reached out to a friend of mine that is a psychologist and what do they call them? Psychologist and psychiatrist, yes. So she's a medical doctor, and I said, I need to book a session, because I don't understand how I feel. This is strange. I've never been locked in the house for 3 months before. I feel different. I'm having anxiety. Waking up the next morning, I feel like, oh, all this work I have to do by myself, and I booked a session, and I think we had a follow-up session, and we was basically having conversations like this, and she broke it down and she made me understand there are different reasons why you can feel overwhelmed and feel like this, and these are people that will just explain to you why being locked up in the house can elevate certain levels in your mind, in your body, make you worry about the future, and all those things together, are affecting you. They can tell you, to do mind exercises or actually do more physical exercises. Physical exercises are really good for the mind, honestly. Until you start to exercise, you won't know, what I'm talking about until you actually do it. So there are actually people that are psychologists. They are not
And we also have
they are not
psychotherapists.
psychiatrists.
We also have psychotherapists.
Therapists, yes. They are not psychiatrists. Psychiatrists are the people that are even will medically, treat you like, okay, maybe, it's an extreme. I'm just saying somebody that, is talking to you, so it's not like you are crazy.
Like a psychologist.
Yes, you are not crazy to be talking to a psychologist. And you also find that there are a lot of initiatives. Even in our church, we have professional counselors. People that you can go and meet and say, oh, I feel this certain kind of way. I'm overwhelmed in my business. I'm overwhelmed in my career. What can I do? These are people that are professionals. They are not your sister or your friend or your mother that will just tell you, be strong, be strong. In our generation, we are strong women. No. There are people that are professional, that have dealt with all types of, people, and they understand exactly what you're going through. So in this generation where we are, especially in a busy place like Lagos, as you are doing your blood pressure, there's your mind pressure as well. There's a mind, and they say those things are silently like, it's true. They say it's silently
Even that doctor told me about she died all of a sudden. Nothing was wrong with her. She was working and she was checking somebody. She was actually in the hospital
checking
on someone else.
She was taking care of her mother-in-law who now outlived her.
Yes.
Was it not her they should have been taking care of?
Thank you. And she was checking on somebody, and all of a sudden she just slumped, and she was in ICU and she died. So if this thing is something, this mind pressure we talked about is very, very real.
Whether or not you feel it, you should make it a habit to be a circle, to be in groups, in community. There are a lot of women communities all around that you talk about, if you're a married woman with children, join a community of married women with children. You see that there are a lot of things that they are also going through, that you are going through, and when they talk about it, it helps you, because it helps you also unwind and say, oh, me too, I'm going through this. When you talk about certain things, it releases the pressure.
Yes.
Don't be superwoman.
carry
Don't do
everything.
it by yourself.
Yes.
There are all sort of communities. Find the right one, the right channels, maybe
Very
from your
true.
church
Yes.
or from your office,
Yes.
where you guys can come together once a while, invite, a psychologist, someone that can talk to you professional, and make sure you do these things regularly. Don't wait till you are now having headache consistently. Or a lot of us, our mothers, the reason they shout on us so much, we don't understand that it's mental health. We think it's normal. We feel, oh, my mother was a strict disciplinarian. It's mental health.
Yes.
She couldn't balance it.
Yes.
She was overwhelmed. So she was letting out steam on us.
Yes.
We felt, oh, she's no. You don't have to be shouting on your children all the time. You can let out steam in other ways, to cool down your mental state, and to be more efficient, loving, and effective, in life. So check up mentally, have people that you talk to, that relieves your stress regularly, maybe once in a month, once in a quarter, but it's important that you do these mental checks.
Thank you so much. You see what she said now? I'm a typical example of what she said. There was a time I was sweeping things in my marriage. I was sweeping things under the carpet. I would always say, let me just let it go, let it fly. It was always going inside. At a point, I almost had what they call autoimmune disease. That autoimmune disease means your body system, your immune system will start fighting itself, attacking itself. And sometimes, if not for Christ, if not for prayer, I wouldn't have come out of it. I started having nerve issues. A lot of things were going on inside of me because I was trying to cover a lot of things. And when you are a pastor, you are an evangelist, you are working in the fivefold ministry, there are lots of things. People think you are just okay. You're perfect. A lot of people come to you. There's nobody to go to, and a lot of people will tell you it's not everything you discuss outside. You're a pastor.
Yes.
People are looking up to you and all of that.